This is my recent project working on these areas of healthcare marketing, lesson protocols, present trends, and innovation for tomorrow. We all are healthcare management, and we are going to be present and somehow potential for the English healthcare industry. I think it will be much more helpful for all of you regarding this title presentation. Thank you again. Now, real scenario comes here without mic, and I think I'm audible to all of you from last. Yes. Okay. Regarding our contents, we are practicing as a healthcare market and marketing context. Regarding these contexts, we are having this content of presentation. What are the marketing concepts in healthcare? What are the shifts from traditional earlier practices and upcoming days modern marketing practices? There are a few 10 cutting-edge techniques of innovation in marketing field regarding healthcare sector. Okay, we know what is market. Market is basically it is a place where we are having objectives regarding the sellers as well as buyers. Sellers have their own objectives and buyers have their own objectives relating with the common platform for buying and selling things. It's all about exchanging goods and services which are valued to us with respect to information we carry about the marketing. Marketing is this market have dual objectives with respect to buyers and sellers, and marketing is a service provider based, organization based, or service institution based effort functions which helps in actionable ways to process for creating value for something what you are going to deliver by analyzing the need of the market. With respect to the buying and selling in commercial way, healthcare context also focus upon getting things making a relationship to each other with the community, individual, and overall. This is a strategical motion in long-term journey of any organization-based institutes for providing health services, healthcare service providing institution. It has ethical concerns regarding making and delivering the services as well as the community health prospects and overall nation's economic aspects of gathering all services together for promotion of health and their care. Basically, we are up to what are the shifts regarding what are the things we used to practice as a marketing in earlier days. Here we can see that since 15th to 20th century, it was the popular ways of marketing things like newspaper, ads, TV commercials, and all publications through billboard. Now it has transferred, in recent modern days, we are having digital ads like Google, Facebook, LinkedIn, and other things are upcoming days for today modern marketing context. So these are the some evidences how marketing is working in digital era in today's context. The various researchers have said that there are more than 70% of patients are searching before they are going to get any services in booking appointments and earlier ways of getting services. More than 60% service providers, organized, and doctors are also they are also saying that social media is improving quality of healthcare in connecting, interacting with people and the service provider. So we can say again, word of mouth, it is more effective ways to communicate our service, product and healthcare product and services, and it is more effective today also. So in this modern marketing, it has been working as online reviews and reputation. We all have also experienced we are going to get any services, product, healthcare services, or any products, general products, we are going to get it from online reviews, their comments and stars, and we are going to read its comment and what people are saying about that product, whether we are going to get it or not. So these are the few things we are working on as a modern marketing. And so there are some organization-based marketing techniques who are also improving their trust, making a reputation management through online reputation management that may grow their services in many ways by influencing patient and their decision making towards getting their services. More than 90% patients are like always looking for reviews for any service provider. Their reviews, their merits, their good things, what the service they are providing. Any start, we are also, I think we are like trending about giving stars and looking stars. 1 star counts for like 5 to 10 approximately. Like Google rating makes revenue 5 to 10%. This was the research done by the Harvard Business Review. So moving next to the trend, modern marketing also is influenced by brochures and flyers. Like we used to work with that brochures and flyers. Now we are shifted towards the content and new marketing through blogs, YouTube, infographics, and podcasts. So many hospitals are always also practicing in like subscriber-based services with respect to million views and their promotion of their healthcare service providing strategies. And we can also feel like in younger generation are always they are influenced with the online things, and on that basis, so healthcare service provider has also shifted towards like TikTok, Instagram, Reels, and many other online popular platforms to give their information, communicate with the younger generation as well. So here are the video contents, potency like engagement of 2 to 3 times. Like we have evidence of recent trends. Again, we are moving to the traditional to modern marketing to mass advertising. It used to be, and we can also see mass advertising through boards, digital boards. Now it's shifted towards the personalized and data-driven marketing, like chatbot. Even though we also know that when we are getting services in low contact services, we are going to get chatbot services with no people around us. But when you are going to get bank account in any bank, then you are going to get chatbot services with no people. So that way your registration can be also filled up by the AI intelligence, artificial intelligence, email automation, and targeted ads are also used for personalized and data-driven marketing. So it is the personal SMS reminder is used for like we also have so many hospitals that are also using vaccinations. We used to get vaccination and lab reports. Corona times we used to have like online reports, corona reports, and some few hospitals are also using chatbots facilitated by WhatsApp chatbot for appointment and routine and follow-ups as well. So here are also facts like higher engagement, 6 times personalized emails provides the higher engagement regarding any modern service, getting the modern services as well. So moving forward, the next. Now there used to be a physical health camp, and still we are going with this kind of physical health camp where health checkups are organized in villages, cities, and now telemedicine and virtual engagement like online doctors. Also, we see online consultation. We also have like so many organizations like providing their online services in India, Nepal, and all over the world after pandemic, corona. And we can see like USA is also having their prime service provided through online basis, having 10.6 million after post-COVID in their service strategy. We can also here like see prediction from various researchers like forecasted for more than 380 million by 2030 in upcoming days as a online virtual engagement. Now, what are the future healthcare marketing we are getting these days? Basically, it happens for like AI. We all know artificial intelligence and their personalized things. We also know that how we are going to get services through ChatGPT and Gemini, Ultra. Also, we can say that how patient treatment is patients are explored through it. How patient treatment is done through personalized email, as we have earlier discussed, like their service has been tailored to artificial intelligence. And what are the example regarding AI-based services, like we can have the regular activities, culture of leading good habits, healthy habits, and that is always been monitored by AI, and that gives reports for, like example, meal plan for like diabetic patient, and this is like a support which also proves to have the higher engagement of patients rather than generic contents as a modern healthcare marketing service. AI-powered predictive patient acquisition. This we can also know that we have AI also predicts what you are going to get the service. How you are going to get is a different aspect, but what you are going to get, what is your need, that is predicted by artificial intelligence. Basically, you are like exploring with internet things, and your history is being analyzed by some kind of intelligence, and they are going to predict what you are asking for and what the things you are going to get service in healthcare facilities. As a being healthcare organization, you can get a selected target customer through this intelligence. As a pre-diabetic user, if you are we have a service for diabetes patient, and then if somebody is asking, like looking for weight loss and other tips, that person or that people might be your client, in future client, and you can tailor their needs accordingly. So next we have metaverse and virtual reality healthcare marketing. Basically, I think we all know, like virtual reality is like very common things these days. Virtual reality is like entering into the three-dimensional computer world through the virtual devices which we can enter into the virtual realistic ways of exploring anything that is inside the environment of computer-generated environment. We also know that virtually how surgery you are going to experience, what are the things you are going to get in your treatment facility. We can have that tour as well, for like you are conceiving as like baby planning of your baby, and what are your days ahead, how you are going to get a treatment in hospital, where you are going to come, and what are the places you are going to visit, and what are the facilities you are going to get until your delivery days begins. And after what are the post-treatment services are also virtually toured virtual reality. And other thing is like virtual means like if we are together here in same place, virtual doesn't make sense with the physical distance. We can be anywhere in the world, so in a computer generated 3D environment, we can be together. So if I have generated my kind of generated environment by computer, you can also enter into my world. And if you are going to be inside my world, like then that might be metaverse. I think you are going to have some kind of 3D animation, like virtual reality. You are entering into that, and some my friends come into that virtual reality. We are communicating at the same time, same moment, in the same environment generated by the computer in 3D. So there is also like a culture of digital reality consultation. Patients also they are starting to need that, and the service provider organizers also starting to provide that kind of facility in today's world. So voice assistant is another thing, like what we do without touching our hands, like voice conversation for like refilling our form registration and like appointment things. So it will be much more easier for like any service provider and service seeker in various ways of adding up our modern techniques in marketing and service facilitating beside healthcare practices. Blockchain or transparent patient trust. Blockchain is usually a digital ledger. It signifies the activities what you are doing on the basis of time, on the basis of what the objective you are up to it. You are getting service or product, and what are the cost you are paying. For example, you are going to get any services in any hospital, like appointment, and you are paying for like doctor consultation, and you are again for 1 o'clock you are going to doctor's consultation, and 3 o'clock you are going to have recommended investigation, and 5 o'clock you are going to have procedures with respect to all planning. Then those transaction ledgers will be stored in a blocks in different ways, in decentralized ways. It is also, we can also know as a decentralized means the nodes or any computers they are in. So it is immutable. No one is going to change it, or like it is always stored for long-term purpose in a trustworthy way, so that we can have our health information secured. And in recent marketing, crypto rewards is also going to it's been like practice of rewarding cryptos, like for you are coming to health checkups, and that motivates any patient to come and seek that or get that service in future as well. So next, neuromarketing and emotional AI. It is like people like customer usually don't care about your products and services. They care what they think, what is up to their emotion, how they are going to deal with their emotion. So we need to know that what people really think about, what they are in need. That is always addressed by the emotional AI. And so these basically they are artificial intelligence, like they are working with facial expression, voice tone, and many other messages they are getting input in a machine. So stress cardiac patient behave accordingly, and other normal people are like going to behave differently. That is analyzed by AI, and basically marketing on the basis of context of marketing, psychology, and neurosciences and behavior is determined for neuromarketing and emotional AI.
Thank you, Mr. Basnet.